Hey y'all, what's going on? It's your boy Mike. So, just finished work, around time for the Super Bowl, so I'm gonna go home, see if I can catch the game. Don't have cable, so let's see if it's on Peacock or something like that. But work was a pretty good day, and it brought up a message I wanted to talk to you guys about, in regards to like working in a hospital, just in general, but also working as a physical therapy assistant, is to expect the unexpected in a good way or a bad way. You always want to go in with positive thoughts and vibes and things like that, but you have to prepare for everything. Like, what's the saying? Prepare for the worst, hope for the best type thing. Because you never know what's going to happen. For instance, I was walking with a patient, and one of their monitors went off. So the nurse and I stopped. We'd look at the monitor, see what was going on, and it was saying that one of their lines was loose. And I can't give too much detail because, again, I'm not sure if Facebook will allow it, YouTube will allow it. But when we looked, one of their lines was disconnected, and there was a trail of blood going all over the place. So I was like, oh, okay. So my job as the therapy assistant is to check on the patient, make sure that the patient is good. It's like, okay, are you dizzy? How's your balance? Do you need to sit down? Anything like that. Just make sure that that's good. Because the line that was disconnected is above my level of expertise to take control of, so I left that to the nurse. So I'm monitoring the patient, make sure the patient's good. The nurse is monitoring the line, make sure that they can figure out why the line got disconnected, how to hook it up again, with as minimal issues as possible. So again, it's teamwork. However, the funny thing is that this patient walked over 2,000 feet. Walking 2,000 feet, patient's chilling, laughing, kiki, everything. Patient was good to go. Then the monitor started going off. We looked down, and patient's bleeding out. So it's like, holy crap, what the heck is going on? On the flip side, I had a different patient. Looked at the list. It's like, okay, this person is a max times 2 to stand up. And pretty much what that means is that we have different levels of how much help we need to give a patient, from independent to total assist. So I'll go backwards to make it a little bit easier. So total assist is myself, the therapist, is doing all the work for the patient. They can't do anything pretty much. So I'm doing 100% of the work. A max assist is that the patient is like, I'm doing like 80 to like 99% of the work. A mod assist is like, I'm doing like 40 to like 80% of the, 40 to like 75% of the work. A minimal assist is like, I'm doing like around 25% of the work or a little bit less. A contact guard is like, I'm just there to kind of just support you, just kind of like hold your hand if you need it. A standby assist is like, hey, I'm just here, as just to keep an eye on you, just make sure that things are good. You have standby assist, and you have modified independent. I was like, okay, patient is able to be independent with like slight modifications, whether they need a walker, whether they just need, just to let someone know that, hey, I'm going to this place, but they're relatively independent mobility wise. And of course, the independent patient is like, hey, do whatever you want to type thing. So reading to this patient's chart, it said that standing up was a max times 2, which means it took 2 people to do about 80% of the work for the patient. Patient's only able to do like 20% of the work, even with 2 people assisting. So that's a relatively heavy patient. So I'm like, you know what? Let's see. Because sometimes it depends on the day, depends on how the patient's feeling. There's so many different variables. But I'm like, no, let's go ahead and see. I already have the nurse on standby. I was like, hey, we always chat with the nurse before we go to see any patient, because things happen. I'll get to that later. Things happen. So I always chat with the nurse. I'm like, hey, how's this patient doing? Are there any issues? So on and so forth. Like, patient's doing good. They're a little lethargic, a little tired. Go ahead and see them. If you need my help, just go ahead and ring me up. I'm like, okay, cool. Went to the patient's room, chat with the patient and their family member. Like, okay, I'm Michael with physical therapy. Came to get you up and moving around and see what we can do. Like, okay, cool. I'm like, okay, so our goal is to get you to the side of the bed. If we do good with that, we're gonna try to stand up and then kind of go from there. I'm like, okay, cool. Like, okay, let's see how you do get to the side of the bed. Can you move your legs? Yeah, I can move my legs. And slowly start moving the legs. I was like, oh, okay, cool. They got to the edge of the bed pretty much with like minimal assist, so I did like 25% of the work, if that. They did awesome. I was like, okay, cool. Let's see how you do standing up. Because again, this was like a max times 2. So I'm like, let me see how you do standing up. I'm like, I'm going to try it standing up by myself first. If we need help, I can go ahead and get the nurse. No problem at all. The nurse is already aware. But let's see what we can do. Got into the patient's arms, stood up, mod. I was like, okay, cool. Again, moderate assist, I did like 50% of the work. Okay, the patient did really good. Now, we had to do some slight modifications. So we have to block the knee, we have to block the foot so the foot doesn't slide out, so the knee doesn't buckle, things like that. However, with that, the patient was like a mod assist to stand up. I'm like, that is really awesome. Was it the prettiest? No. Was it functional? Yes. So I was like, okay, very nice. So what I'm going to do is I'm going to go ahead and grab the nurse so we can make it pretty and functional. I want you to be as upright as you possibly can. I want you to be looking over my shoulder, looking outside, the whole thing. So okay, cool. So went ahead and grabbed the nurse. Let's see what we can do. I was on one side, nurse on the other side. Stood up, 1, 2, 3. Mod assist. I was like, that's awesome, you did good. Previously, the patient told me, hey, I want to sit in the chair because my back's been bothering me from laying in bed so long. I want to sit in the chair. I think a change of position will be good. And depending on how acute the patient is, like how much the patient help the patient needs, depending on what time it is, we will help to get the patient in the chair. But sometimes we may not be able to get them back in from the chair to the bed, depending on what time it is, and things like that. So one of the things I told is I told the patient, hey, I'm gonna go chat with the nurse to see if the nurse is okay with this, because I won't be here much longer, and I want to make sure that the nurse is okay to get you back in bed. I said, okay, cool. So after we stood up, talked to the nurse, I said, hey, so this is the patient's goal. The patient wants to sit into the chair. Do you feel comfortable getting the patient to the chair? All right, or getting the patient from the chair to the bed. She's like, we can try, but we can also do a Hoyer lift, which is pretty much like a giant hammock. Now, okay, cool. Like that will be perfectly fine. And then a lot of the rooms have like have a built-in Hoyer on the ceiling, which is awesome. All I have to do is get a pad. So pretty much how we set this up is we put the pad on the chair. Patient sits in the chair. When the patient's ready to go, if they can't stand up, then we actually bring down the straps down from the ceiling. Attach the pad that's on the chair to the straps, and kind of just picks them up like a giant hammock. You can kind of push them to the chair, push them to the bed, and lay down. It's really dope. So, okay, let's go ahead and get the Hoyer sling. Put the Hoyer sling on the chair. And okay, let's see what we can do. So, got the chair nice and close. I was on one side, nurse on the other side. To the patient up, little shuffle steps, nothing crazy, but like a total of like 2, maybe 3 feet walking, total distance. But walk the patient to the chair. Again, this is a patient that said max ×2. You never know what's going to happen in the hospital, in a good way or a bad way. Again, that was a good way. The bad way, I went to see this patient early this morning. Talked to the nurse and said, yeah, the patient's good to go. See them whenever you want to. Okay, perfect. When I go see the patient, patient's like, hey, I'm Michael with physical therapy. I came to work you out, so on and so forth. Like, hey, thank you for coming, but I'm in a lot of pain right now. I don't feel too good. Da 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 da. I was like, okay, I can see if I can circle back a little bit later. There's no guarantees, but I can try to circle back a little bit later on. Okay, that'll be perfectly fine. All right, cool. So went to see a couple more patients. Went charting, eat my lunch, came back up, talked to the nurse. Hey, can I see this patient? Nope. We had to call rapid response on the patient. Had shortness of breath. We had to put them on oxygen. All these different things. I was like, oh, okay. Defer. Again, defer means that we just can't see the patient. Are they still on our list? Yes, they're still on our list, but we just didn't see them today for whatever reason, whether they're down for a test, the nurse said this, the patient said this, whatever. So I went to the patient's room. I said, hey, I'm not getting you out of bed. I always like to give a warning. I'm like, hey, again, it's me. I'm not getting out of bed. I just want to check on you. I talked to the nurse. They told me what's going on, so I just want to let you know. I hope you get better. We'll kind of check on you like as you're healing up. I just want to let you know that I did talk to the nurse. We're not going to do therapy today. So I said, okay, thank you. You never know what's going to happen in the hospital, which makes it fun, but nerve-wracking at the same time. And the thing is, the interesting thing is, like, all my patients they're listed as like a minimal assist. All my patients. I usually have like 10 patients a day, to start off with. Now we'll pick up patients like as we're going on, if we're losing patients, if we're not going to meet productivity within a certain time period, if a bunch of people just could say, hey, no, I want to see therapy, whatever, for different reasons, we'll pick up patients. But we start with like 10 patients a day, 10 to 11 patients a day, depending on the unit, depending on the acuity of the patient, depending on the treatment also. Because there are some patients that you're in the room for 8 minutes. Some patients you're in the room for over 2 hours. You never know. I had one patient I was in there for 2 hours. Another patient I was in there for an hour. Another patient I was in there for an hour and like 15 minutes. You never know. Then I had a patient that was in there for 23 minutes. Sometimes you're in a patient's room for 8 minutes. You never know what's going to happen in the hospital. You have to expect the unexpected. You have to expect that not everything is going to go the way that you want it to, fortunately or unfortunately. Because sometimes it's for the better, for you or for the patient or just for the overall situation. You never know what you're going to get. Do I recommend, therapy assistants to work, like physical therapy assistants to work in a hospital? At least a little bit. Because there's a difference between working in the hospital and working in outpatient. Working in outpatient, you tend to be able to be a little more creative with some of the different activities because the patients aren't as sick. The patients aren't as sick, generally speaking, because we have some patients that are relatively healthy in the hospital. They may come for one reason or another, but they can sometimes they can walk by themselves or different things like that. We just kind of like checking on them, make sure they're good. Do I recommend someone work in the hospital? Yes, I do. Because you're able to think on your feet. You're able to like check their body language for different things. You can check their body language in outpatient also, but it's a little bit different in the acute care setting. You're able to learn a lot about yourself, how you handle very stressful situations. Because there are times that you are running to very stressful situations. There are times that you're walking in what we call no man's land, where there's no chairs around, it's just you and the patient, and the patient's eyes start to roll back. And you're like, what to do? You have to think on your feet. It's like, okay, what can I do? Okay, there's nothing there. I don't see anybody. So you have to think on your feet. And it teaches you how to, like, working in a hospital teaches you how to think on your feet. It teaches you communication skills. It teaches you how to make light in dire and scary situations. Because again, a patient I had the other day, walking in, one of their lines, got undone, and there was blood dripping on the floor, and not a little bit either. And we were like, hey, how you doing? You doing good? You getting this, everything like that? And like, no, my tomato juice is spilling. It's like, what? Come on, man. So you have to have fun. You have to figure out how to ease the person's stress, because the patient is stressed out, because the hospital is not a fun place. The vast majority of patients don't want to be there. Some patients, they think that's the Taj Mahal. They think that's the best. It's the Ritz-Carlton. I don't get it, because you don't get any privacy in the hospital. People coming in at 4 o'clock in the morning, checking your vital signs. You got to ask people to go to the bathroom. You have no privacy in the hospital. But some people love staying in the hospital. I don't get it. But no one wants to be in the hospital. So if I can make your day easier, it's gonna make you feel happier. It's gonna make you heal faster. It's just gonna lighten up your day, make things just so much better for you, in the situation that you're in. And also, it can be a coping mechanism for the providers, whether you're a therapist assistant, nurse, doctor, even nutritional services, even housekeeping. Having a light sense of humor can make life so much easier, because there are times that you're the only smile that people will see. There are times where people are just stuck in one position, and they're sad, and they're pissed off, and they're angry, and they don't know what's going on. So if you come in, all grumpy looking at the grouch, it's not gonna be a good time. So you have to figure out how to find your smile in the hospital. And sometimes you have to stretch it as much as you can. And sometimes your smile in the hospital is just saying, hey, I'm not in one of those beds. And not to make it sound like, kind of morbid, or it's like I'm better, or this. Like sometimes we have to just find something even that small, just saying, hey, I'm not in this bed. I can go home at the end of the day. I can drive my car. I can go to the bathroom by myself. Again, sorry if it's a little TMI, but you can move by yourself. And yet you go to a hospital and you see your list by people there for 16 days, 43 days, 90 days, 300 days, and they're stuck. It's like, dang. So it just gives you another appreciation for different things. Just working in the hospital, it just gives you appreciation for the life that you have and the things that you're able to do. Even if things aren't as great as you want it to be, it gives you a new appreciation for what you have. So do I recommend people work in the hospital? Yes, because patients are also a lot stronger than you think they are. For instance, there are times I've had 90-year-old patients that are like, okay, this is going to be a struggle, and they're walking 700 feet. I'm like, getting up by themselves, taking showers by themselves. It's like we got, Joe over here who's 50 years old, who can't lift their pinky, who can't lift their arm because they broke their pinky toe. It's like, but you got Grandma Gretchen over here, who's 93 years old and just had open heart surgery, and she's walking 700 feet plus. Make it make sense. Do I recommend everyone work in the hospital? Yes. It's interesting. It tests your mental, your emotional health. It makes you stronger. Have I ever worked in outpatient? No, I have not worked in outpatient. I've thought about working in outpatient for a while. The thing I didn't like about some of the outpatients is that you're seeing multiple patients at a time, which I get it, but that wasn't for me. I prefer that more one-on-one setting, so I can actually get to know my patients compared to feeling like in an assembly line, because that's how I personally felt when I was doing my clinicals. I felt like I was in an assembly line. So okay, you do this, you do this, you do this. I'm like, not my jam. Now, everyone has their different things. Some people love it. Some people love outpatient. Hey, if you're an outpatient therapist, hats off to you. If you're an acute care therapist, hats off to you. If you're a nursing home therapist, hats off to you. Do your thing. Because there's a setting for everybody that wants to be a therapist. Whether it's hospital, whether it's outpatient, whether it's school, whether it's a nursing home, whether it's home health, whether it's pediatrics, whether it's sports med. There's so many different things that you can do as a therapist. The interesting thing that I found out when I was in school is that PTs and PTAs can actually work in a dentist's office, because TMJ. You have to work those muscles. You have to train those muscles. So you can actually work in a dentist's office. You can actually work with a veterinarian. You can actually work on horses. You can work on dogs and exotic animals as a therapist. So there's so many different things that you can do. That's why I say that there's a setting for almost everybody in therapy, because you have to think outside the box a little bit. Again, I work from home as a health and wellness coach manager, but I use some of my therapy skills, as my health and wellness coach job, and I also use some of those skills in my therapy job. So it kind of just builds each other up, both sides. So have I wanted to work in outpatient? Yeah, I wanted to work in outpatient. Would I? I don't think I will. No, I'm good. I'm good working as a health and wellness coach and working as a PTA. No, in the hospital setting. Don't want to move up? Yeah, I want to move up. So we'll see. As things go on, I'm gonna keep my eyes open. Particularly as graduation is getting a little bit closer, I'm definitely keeping my eyes open. Towards that second half of the year, and middle of the year, second half of the year. See what's open. See if there's anything available for me, internally or externally, at any of my jobs. Because again, your boy works too much, but I do like working hard. Because again, it tests my mettle a little bit, tests my mental, and also it's like, hey, you can push as hard as you can. You can keep pushing. Because have you hit walls and roadblocks? Yeah, I keep going. I kept going. So we'll see what happens. But again, just wanted to stop in a little bit, and again, just let you guys know that the hospital is an interesting place to work. You have the highest of highs, you have the lowest of lows, everything in between. You meet interesting people. You meet people you wish you've never met. So you get everything. You see things that you didn't think you'd see or you don't want to see. It's like, You smell things, you hear things. The hospital's a wild place, but I like it. Because again, you never know what you're gonna expect. You never know what you're gonna get. Even if you've seen the same patients, you never know what you're gonna get because people change on the day. The hospital changes. Again, patients change every hour. You never know what's gonna happen. So yeah, just want to stay here, chop up with you guys a little bit. If you guys have any questions, comments about the hospital life, what it's like to be a PTA, anything like that, just let me know what's going on. But until next time, later.